Umechoma hiyo.
Karibu. Hebu nisho.
Ndio na record. Ati
sasa si nimestukia. Nimengojea hiyo clap yako.
Nimengojea clap yangu. Haya sasa tuzidi. Unataka kusema hi guys. Wedo.
Tuseme nini? Welcome to the channel. Tuko very serious. Welcome to the channel.
You've probably seen him before, the other video where we were a cohort of individuals, but you see alikuwa amekaa the fringe areas and he was very silent, so we are trying to you are silent, so we are correcting that today. This is my friend Misoi Brian. He's a doctor, he's a surgeon, and it felt befitting that when I discuss the history of surgery that he be here with me. So I hope you guys enjoyed the episode.
Thanks guys. And he's lying, I wasn't silent. I think he cropped out what I said before, but I hope you'll enjoy this session. We'll just be talking like casually about the history of surgery, and it's quite interesting. I think there should be a movie out there if there isn't, and if there is none, Tabu, this is your job.
So when you go to the hospital and you meet a surgeon, you see surgeons have this air of pride around them. It's okay if you think that they've always been people who have been the mainstay in the medical practice since time immemorial, but you'll soon find out that this isn't the case.
I think pride is I think the word is nonchalant and calm and composed. That is very much in keeping with what they used to do in the past. They needed a steady hand, emotionless.
Okay. Umesema emotionless ama motionless?
Emotionless. A steady hand, emotionless, fearless, and fast operator. Basically because you have no still patient. The patient is moving and is in pain, screaming, and that's what you need to do. To operate.
Which brings out a very strong point that in as much as nowadays surgeons normally operate on patients who are not in pain, long time ago there was no anesthesia.
Yes, so that is what I was referring to. There was no anesthesia. So you don't have a still patient. Your patient is trapped on the table and you need to do whatever you need to do as fast as possible.
Okay. And then even then, surgery has come a long way. Like in the beginning, you see, like when doctors right now are split between being a surgeon and being a physician. So what is key in the history of surgery is that when it started out, the only people who were called doctors were physicians. So physicians would be people who treat like coughs, people who don't necessarily know how to hold a scalpel. Okay, let me change that. People who don't usually, yes. but they probably know how to. But
it's a last resort.
Yeah, though the jury is still out on that. So physicians used to be the only ones they used to treat royalty. If someone has a headache, if someone has asthma, they'd jump in and give their very subjective medication. But since they were treating something that was almost unknown, they were regarded with a bit of, like, they were mystical beings. So the only people who were surgeons, there was no surgery at that point. The only people who were surgeons were, and this is quite apt because I'm just from the barbers, and I think I look relatively and also absolutely, I look quite well shaven. Don't know relative to who, but yeah, whatever.
So we'll talk about the cut later.
Yes. So the only doctors were physicians and surgeons were barbers, because barbers were the ones who had scalpels. They had razors, and let's say they're just shaving your head, and if they see something that's jutting out, something that seems to be out of place,
they just pull it, yank it out.
Yes. So the only surgeries that were done were superficial surgeries. And so that's one of the key issues about the history of surgery, that started out as barbers, and because they were not doctors, I think you should take this part.
In the UK, surgeons are called Mr. Female surgeons are called Miss. And this is because early on, when the profession began, physicians refused to recognize these barbers and butchers as doctors because they didn't have any qualifications. and they didn't study medicine. They didn't have any college or any school that they attended. They simply cut off things. So up until I think 1800 is when the first college was started. That's the Royal College of Surgeons in the UK. And from then on, they've been proud to be known as well-trained doctors, but they still refer to themselves as Mr. They retained the title with pride after forming their college. That's, I think, 1800. So that's in the UK. In the rest of the world, they still refer to us doctors.
And this is unconfirmed, but nowadays the roles have been reversed. Physicians want to be called Mr.
Okay, so some of the things that surgeons used to do, the early surgeons, the barbers, basically the operations they used to do without any anesthetic, and there was barely any asepsis. That means there was no effort to try and limit infection. Some of the things they used to do is pull out teeth. There's procedures described as bloodletting. They used to do what is called stone cutting. That's removal of a stone in the bladder. And amputations. So amputations could be because of trauma or patients with tumors. So particularly there's one funny story of a surgeon. His name is Liston. So what he did, he had a patient he was doing stone cutting. That's removing a bladder stone. And the patient was on table, strapped down and held down by strong men. You can imagine in this instance, the most important thing was speed. You were not using any basis in terms of anatomy, just a few ideas as to where you're cutting. Speed in terms of how quick you finish your procedure, because one, you had to control the blood loss, and two, the patient could not withstand that pain for that duration. Sometimes they would give wine, but no amount of wine
could work as an anesthetic agent.
Cannot be an anesthetic agent.
Yeah.
So this guy Liston had his patient on the table, held down nicely by 4 able-bodied guys. And remember, he's sick. He's a sick patient, so he's not that strong. But once the procedure began, the guy was so scared and so much in pain, he fought off the men, cut off his straps or pulled off from his straps, ran out into a certain room and locked down himself. The surgeon, being a surgeon, knocked down the door, kicked down the door rather, carried the guy back to the table and finished the procedure using force. So, I mean, I understand where the physicians are coming from.
Let me tell you another story. So now, just to show how barbaric surgery was. So now, you see, all surgeries, before we became fine-tuned gentlemen, surgeries were actually like showcases. You put, like, it was like a coliseum.
You're in a theater.
Yeah, it's a I think that's where the term comes from.
And you're well suited up.
So you're in a theater, people come, the public comes to the gallery to see you perform the surgery. So there's this surgery, the 300% mortality surgery. So of course there's no anesthesia. Of course the patient is in pain, the patient is not calm, the patient is moving a lot. So it was an amputation. And those times, amputations used to be like, surgeons used to compete with each other who would carry out the amputation the fastest. So this surgeon, I don't remember the name, surgeon is doing an amputation. Since he's doing it so fast, the assistant is there. Of course you're not keen. He cuts off the assistant's finger too. So assistant's finger is out, patient's leg is out. Now, in that moment, the patient is in pain. Patient is moving around. It becomes chaotic, just like the story you've told us. The scalpel or the knife or whatever he was using could have been a panga. It gets flung and it hits one of the guy watching. The public that had come, one of them is hit by the panga. So that guy died. The onlooker died. The patient died because the procedure was so chaotic, bled out or whatever.
And the guy and the
assistant
got an infection and
died. So 300% mortality surgery. So
I mean that's just wild. I mean,
yeah. So that goes to show just how much surgery has come to become better. So we are going now we are going to discuss the aspects that have gotten better for surgery so far.
So before the 1500s, it was forbidden, as usual, by the church. Forgive me. It was forbidden to dissect human bodies, and with reason, of course. But the necessity grew because we needed to understand the human body both for diagnosis and for treatment purposes. First dissections were done around the 1500s on human bodies. Again, at this time, there was no agents that we use nowadays to fix these cadavers. Students would endure a lot in these classes in terms of the smell of rotten bodies, exposure to infectious agents. But they managed to do quite a bit of dissection, and they formed the basis of what we know now as human anatomy. And that was refined even further by, guess who? Leonardo da Vinci. Is there anything this guy hasn't done?
The knowledge of anatomy has really had a lot to do with the improvement of surgery, as much as we know it now. So the other thing that has really sorted out surgery is the discovery of antiseptics or antibiotics. So previously, people used to go through surgery and then you get an infected wound, you get sepsis, and you just pass on because of that as a complication of surgery. So once antibiotics and antisepsis was discovered, that really went a long way to help with surgical procedures. I think there's Lister.
Lister was the guy.
Was the guy who discovered antisepsis. That's why there's, remember that question you asked, Listerine from Lister.
Mark.
Yeah. Then the other thing that really helped with curtailing infections was the discovery of gloves. So the story for discovery of gloves, this was done by someone known as Halsted. The issue was, before, people used to dunk their hands in, what was that antiseptic?
Phenol.
So,
yeah. I think very corrosive.
Yeah.
Just dip your fingers, not your whole hand.
But now, his assistant, who was a female, was allergic to this antiseptic. The story goes that Halsted and the assistant had something going on. So Halsted didn't want to let go of this assistant just because of the allergy. So one Halsted ran to, the chemist of that time or wherever people got gloves and gave it to the assistant to do the procedure. So at that point, that's when the use of gloves became rampant in surgical procedures, and it also helped to reduce infections, which improved surgical outcomes and the surgical practice.
Halsted, by the way, is the father of surgery.
Halsted is the father of surgery.
He's one of the guys that is revered. Just on that note, regarding antibiotics, before the advent of, I think, penicillin, if you got an open fracture, you would almost certainly die.
What's an open fracture?
An open fracture is basically a wound with a broken bone.
Yeah.
So guys from war would almost always die from infection. That's the power of antibiotics.
So just so you understand, an open fracture is a broken bone that pierces the skin. So since the skin has been pierced, you can get infections easily. You're stretching your audience.
Thank you, Tambo. But we cannot understate the importance of antibiotics in surgery.
Yeah. So Halsted being the father of surgery, I think the reason why he is credited with this is that he came up with the collegiate system. So that in as much as the surgery anatomy was being taught and physiology was being taught to surgeons, Halsted actually bared down on regions collaborating, so that surgical practice now became, what's the word I'm looking for?
A college,
but in different areas it would be the same. It became standardized, yeah. So surgical practice became standardized, and that's how the profession grew, because different regions would be borrowing from each other and would be growing at almost the same pace, and surgery now became pervasive. Yeah, that really went a long way into helping surgery.
And what he also contributed to was the residency programs as we know it, the training programs, where a surgeon has a number of years under a certain qualified, well-trained surgeon. They learn as an apprenticeship along with their other academic sessions.
Okay.
That's what Tabu is doing. That's what I'm also doing, but I'm also almost done with it.
Almost surgeon.
Almost.
Working to be almost surgeon. That's me. Of course, the last thing that really helped surgery grow, as we've mentioned, all these theatrical cases that were done in theaters back in the day, patients running away and 3 patients dying at the same time, all this was amended by anesthesia coming through. So with the understanding of anesthesia, patients became more calm. You could be able to control patients when you're doing any surgical procedure on them, and surgery grew because of that. That's why currently surgeons and anesthesiologists are very good friends. Wouldn't you agree, Misoi?
Ha ha ha. On that note, on anesthesia, so it was impossible to do any, like you said, they were doing a lot of superficial things, cutting lumps, all these superficial lesions. But it was almost impossible to
go deeper.
To work either in the chest. Chest was unheard of. But stomach, the stomach, as the layman would know it, the abdomen, it was again impossible to do extensive surgery there. But with the advent of anesthesia, it drastically changed what the surgeons could do. And the more the surgeons could perform complex procedures, the more they pushed the anesthesia part of medicine to improve.
To facilitate their surgical escapades.
Yes. So it has been a sort of hand-in-hand improvement. The more you increase your complexity in surgery, the more you have to increase your anesthesia complexity. And the more you increase your anesthesia complexity, that means you can do even more. So
you pave way for surgeons to actually grow.
And carry on with innovative new surgical techniques. And then the other important thing is, it didn't just happen in a flash. It was a slow, stepwise introduction of anesthesia. And it started with simple things like what you see in the movies. Guys coming in with the handkerchief. And I don't know, what do they use in the movies?
Chloroform.
Yes. So they sprinkle some chloroform, put it in your face, and you black out.
In the movies, how long do they take to black out? Like around 10 seconds, almost immediately.
Almost immediately. I don't know.
Do you know like chloroform normally takes 5 minutes to
really
work? Yeah.
I've never thought about it. Yeah. So it's not been an overnight change. It's been a progressive thing, and even the management of the airway, that was a big step in anesthesia. They initially used to use metallic tubes. Can you imagine someone putting a metallic tube in your throat?
Your trachea. Coming out with biopsies.
So everything changed, and allied, can't forget the allied services, medical innovators. I don't think doctors know enough or can take their time enough to manufacture some of these things. So they had to have people who would produce these things, factories that would make these plastic gloves or rubber gloves, industries that would make instruments.
So you're saying the growth in surgery hasn't been just on surgeons themselves.
Yes.
It's been
there's a lot of
untold stories, and that we will also not tell much.
Yeah.
Because you see, we need most of the accolades to fall on us.
Surgeons being surgeons.
Yes.
Yeah, but it's a big growth, and we've also embraced the growth in our country. Laparoscopy, we are yet to have any robotic surgery being done here.
And I think you're still going to the last part of this video, as in why is it important for you to understand the history of surgery, as in what you're saying, because it keeps growing. We're not trying to say in any way that we've reached the pinnacle of surgery. There are many things that are coming out, robotic surgery, a lot of innovations, even by the allied industries. So when you understand where you came from and that you grew to this point, you won't be perturbed when you see certain improvements, because most people are very static. They feel threatened when they see robotics, and people start worrying, does this mean that
this new innovation
they'll kick me out of my...
No, you just have to think the new age surgeons have to adapt, because in as much as this progress is coming in hot and fast, you should also embrace it just as fast, if not faster. Because the practice is changing.
And as you see, when you say hot and fast, that's what really puts people off their game, because they feel like they won't have time to adjust. But these changes, they're not coming hot and fast per se. It's a gradual increment. So if you, as a self-respecting surgeon, I'm really speaking as if I'm a surgeon already, but if you are a self-respecting surgeon, if you are doing your level best in your profession, then as the incremental changes come on board, then you'll also keep up with being a self-respecting surgeon. And by the time it's a whole paradigm shift, you'll have shifted with it. So there isn't much to worry about, really. Change is inevitable. Change is good. And so that's why you need to learn about your history, so that you can also grow with it as it. You can embrace the future because there's a history.
True. The other big thing is information. Surgeons now are exposed to so much more information compared to even 10 years ago or 15 years ago when the internet wasn't available. So all you would read were texts that were written, and you can imagine writing a textbook and editing it takes a long time. So by the time that book is out, perhaps the knowledge is predated already.
Yes.
So many books are now online, and they keep updating them chapter by chapter online, because you can't keep up with the information that's coming out if you want to make a hard copy book that you'll distribute.
So that's better in that regard, that we have more information.
We have more information. We're exposed to even videos to learn things. If you want to learn how to do an operation, you can check online. There are online courses on things like that. And the other important thing is surgeons also moving towards high levels of specialty. So it's easier to keep up with the progress if you're focused in one field. So in as much as you're, say for example, you're a general surgeon, if you decide to focus on, say, colorectal surgery, that is surgery of the rectum or the colon, then it's easier to keep up with the developments, new laparoscopic techniques, new endoscopic techniques, all those things, if you're an authority in your field, rather than if you're practicing a lot of things in general.
You'll feel very threatened by the changes because you don't know much of anything.
And I think in medicine, the theory that it has worked, so why should I change it, may not entirely apply. This is one of those things that it's not broken, but you can fix it. You can make it better.
Touche. That's our parting shots.